Who knows? Thank you so much for being here. I know you're both extremely busy and that you don't get anything out of this. So thank you so much. We appreciate it. I know so many parents have questions right now. It feels like we were waiting for this vaccine for so long, and then suddenly it's kind of upon us. And we don't know a lot of information and we don't know where to get a lot of information that's accurate and good. First of all, let's just open by asking, how do you feel about the vaccine being available right now?
Yeah.
Dr. Higgins?
So, gosh, for my own children, I like to say up front that I have a 7-year-old, right, who I'm excited to be able to vaccinate, but also for my patients and for kids all over Montana. Gosh, I'm so excited that we now have an extremely effective and safe vaccine that can protect kids from the real harms of COVID-19. For 5 to 11-year-old kids and for their excited parents, it's now your turn to get this protection that so many older children and adults have benefited from now for almost a year, right? And now it's your turn. One thing that I've been thinking a lot about and that I talk to parents and even children a lot about is that just because COVID-19 is causing less illness and death in children than adults, that does not mean that children are free from risk. Okay, even otherwise healthy children are experiencing long-term complications, such as long COVID, if you've heard of that, myocarditis, this disease called MIS-C, respiratory failure, hospitalization, and unfortunately death too. And it really is dangerous, even to young, otherwise healthy kids. And going forward, this safe and effective vaccine now makes COVID-19 infection and these serious complications a preventable disease. And in pediatrics, as pediatricians, we love being able to prevent diseases from ever happening, right? And every single child going forward who is 5 to 11 that is hospitalized or unfortunately would die from COVID-19, gosh, it's even more of a tragedy than it otherwise would be, because it's avoidable now. We have this awesome vaccine that can protect kids.
Dr. J, thank you. Dr. J, what are your feelings going into this new phase for us?
Oh, I'm excited. So I was kind of reflecting about the day that I got my first COVID vaccine, and just being in that physically distanced line with a whole bunch of other physicians and nurses and medical staff workers, and just the feeling, we were so happy. There was like this sense of hope, and it really came quickly. We were surprised how quickly we were able to have a vaccine and how effective it was. And then I also have 3 children. They're a little bit older, so they were all able to get their first dose in May and their follow-up dose in June. And it was kind of a similar, just really exciting time, particularly to know that they had that level of protection. And it really made it so much easier to do things like visit grandparents. And so I'm super excited for families, in my practice and across the United States, for those elementary age kids to have that same opportunity. So this is an exciting time. And I can't wait. We're going to give our first doses on Monday.
That is so exciting. Yeah, I have 2 kids. They're 6 and 8, and I have them signed up for next Saturday through Missoula County. I'm super excited. I also feel like it was a different experience for me. When I got the vaccine, I didn't think at all about, I was just 100% excited. With my kids, I think there's a more protective element. I have all these questions. One of them is, how effective is the vaccine for kids? Is it different than the effectiveness of adults? And how does that compare to the rate of side effects?
Yeah, great question. And before we even go on, I want to say it is okay to have these questions and concerns. I had them too, right? I mean, some parents, there are parents that have just been like anxiously awaiting this opportunity and they're really ready to go. But some parents are hesitant and have a lot of questions, and that does not make you a bad parent. Okay, it makes you a concerned parent, which as pediatricians, we love, right? Because a concerned parent just you care about the health of your child, and that's awesome, right? And so I just like to frame everything we're saying with that lens. So it is extremely effective. I think that sometimes we forget kind of what our goals were with the vaccine, how these vaccines actually have far exceeded our goals. So the clinical trial that Pfizer did showed that kids ages 5 to 11, it was about 90%, just over 90% effective in preventing symptomatic COVID-19 infection. Okay. It was 100% effective in preventing severe disease. That's incredible for a vaccine, right? That is incredible. We were that, like, not in our wildest dreams prior to developing these, we were hoping that we would be maybe 50%. That was kind of the goal. It would be 50% effective. And so these vaccines are incredibly effective. And I think that's really important when you're thinking about this risk benefits, right? That these vaccines really, really do work.
That's amazing. Thank you for sharing that. Dr. J, one of the questions we've gotten a lot headed up to this meeting is, my kids already had COVID. Do I need to vaccinate them? And if I do I need to wait, or do I need to talk to my doctor? What's the plan if my kids already tested positive for COVID over the last 2 years?
That's a great question, a really important question. So the vaccine is still a great idea, even if you've already had COVID. So we know that after you've had a COVID infection, your body mounts an immune response. What we don't know is for how long that immunity lasts, and we don't know how strong, how robust that immunity is. And so for some people, that immunity may last months, but for others, it may not. And so even if you've had a COVID infection, we recommend that you get a boost. You give your body a little boost with the vaccine. And in terms of timing, you should wait until you're over your symptoms of COVID and you're out of your isolation period. So for most children, that's going to be about 10 days. Now, if you've had a more serious illness, certainly if you've been in the hospital or had MIS-C, certainly discuss that with your physician, or if you've needed any sort of treatment. So, some people may need monoclonal antibodies. That's a different situation. So it's always best to discuss with your pediatrician, but the bottom line is, even for those who have had a COVID infection, the vaccine is for you too. It's only going to boost your immunity and help with future infections. So the other issue is sometimes there are new variants. We saw that with the Delta variant, and we know that vaccine provides a robust immunity to help protect you in the future.
Oh, that's such a good point. Thanks. We have a question coming in from Haley. Dr. Higgins, if you can take this one.
Sure.
Many people say they want to wait and see what happens with the vaccine. Can you explain why it's a better and safer decision to vaccinate a child sooner rather than waiting and seeing?
Mm-hmm. Yeah, that is a great question. And so, the way that I'm thinking about this is that we have a lot of good evidence, a lot of people don't understand kind of how the safety and regulation process works for things like vaccines. But in fact, vaccines in general are held to essentially the highest safety level of anything, vaccines, medications, or anything. And arguably, these vaccines have been studied in more detail and more robustly than really any vaccine or medication in history. We have really had this vaccine under the microscope, okay? And we have not only the clinical trial data that has been discussed in the last couple of weeks from kids 5 to 11, but we also, as we were talking about a little bit earlier before we started, there have been millions of kids 12 and up that have received the vaccine, and hundreds of millions total in the United States, people that have received the vaccine. And we are diligently using several different systems to make sure that there aren't side effects, that there aren't things that we would be worried about. And we're watching that safety data really carefully. And given all of that information, we can say that the risk of complications from getting COVID-19 far outweighs the potential and theoretical rare side effects that may occur from a vaccine, right? We have a lot of information. We know that COVID-19 infection can result in a whole lot of horrible side effects, right?
Right, for sure. Thanks.
And I would really encourage families, just to add on to that, when you get your COVID vaccine for a parent, for a teen, for now a 7-year-old, there's an opportunity to enroll in a system called Be Safe. And that is a way for you to actively contribute to the monitoring. And it's I did it. It's really neat that you get an opportunity to check in and say if you've developed any side effects. And I'd really encourage people to look into that. I think that's a way to continue to monitor these things going forward.
Dr. J, after this session ends, where should people go to get the most accurate information about this vaccine and to get their questions answered?
Great question. A fabulous resource that I use, not only for COVID-19, but just general pediatric parenting questions, is healthychildren.org. That is a website written for parents by pediatricians. And we can probably put a link in this maybe, but it's www.healthychildren.org. And they have a great resource page for questions about COVID-19. I would really recommend families look at that website. I also think it's a wonderful opportunity to just call your own medical home, call your pediatrician's office, look at their website, go to your usual source of care. Those physicians that care for your family, they know the resources in your community, they know your family, your child's medical history. So that, of course, is always a great place to start.
And, I would just add on to that. I mean, this is such a challenging decision for a lot of parents to make. And it's made even more challenging by all the different types of information, some credible, some not credible, that's out there. And the important thing is that you bring these questions and concerns and thoughts to a trusted source, like Dr. Jags was saying, to your pediatrician or to your primary care physician. And I would caution, when you see something on social media or when you hear somebody, say something to you or hear something through the rumor mill about the vaccine, I would tell you to stop, consider the source, consider their expertise, and consider their potential motive for sharing the information that they did, and then verify the credibility of what you heard by reaching out to a trusted source.
Oh, I love that. I love those 3 steps, consider the source, consider the motive, and what was the third one? Source, the motive, and
then verify the credibility.
Verify.
Right? Go to a trusted source, right? I mean, I tell my patients and families all the time, if you see something on social media, if you read a news story about something and you have a concern, I encourage you, come and bring it to me and let's chat about it, right? Let's walk through that concern and talk about it, and see if it's a credible concern or question or idea, or whether it's not credible, because there are things out there that are not credible.
Okay, Dr. Higgins, we have a question coming in from Jordan. I'm under the impression that childhood COVID vaccines are just a lesser dose of the adult vaccine. I'm curious about how that guidance was created and how it compares to other early life vaccines.
Yeah, I love that question because that can be kind of confusing, right? So you're correct, Jordan, that it is a third of the dose of the adult vaccine. And when you hear that, if you don't understand how vaccines are developed, you might think, well, did they just randomly choose a third of the dose? Because, kids that are 5-year-olds kind of a third the size of an adult, so maybe they just randomly chose that. They actually do studies where they look to see our goal always in medicine really is to use the lowest effective dose of any medication or vaccine, right? And so they do studies to see, okay, what's kind of the lowest dose that we can give that still boosts the immune system, still gives those instructions to the immune system at the same level as adults are getting, because we know that it works so well in adults. And that's how they went through that process, right? And they found that with this same vaccine, but just a third the dose, they found that the immune response, the immune systems, the boost to the immune system was the same as in adults and older children that are getting the higher dose. And so that's why we're using the same vaccine, but a third of the dose.
Dr. Higgins, this relates to another question we got over email, which is, if I have an 11 and a half year old, should I wait until they turn 12 to get them that next level dose when they're in just a few months, or should I go ahead and get the 5 to 11 vaccine right now?
Good question. I would get the 5 to 11 vaccine right now. I would not wait. Again, we have seen that the effectiveness and the immune protection that you get from the vaccine is the same with this third of the dose. And so there's no reason to wait. Waiting prolongs the chance that your child would get a COVID-19 infection and unfortunately have a complication from that.
Okay, let's head over to Dr. J for our next question. Okay, this one comes in from Morgan. How do the side effects in kids compare to the side effects in adults? Should I plan to take a day off with my kids after they get their shots?
Oh, that's a good question. I thought through this myself when I got my own kids vaccinated. So the side effects in children are somewhat similar to the common side effects in adults, okay? A sore arm, maybe a little redness and swelling, maybe a low-grade fever. Some children will get a little bit of lymph node swelling afterwards, and maybe just a little bit of, fatigue, malaise. Those are generally short-lived. So you're going to see those within that first 24 hours generally after the vaccine. So children tend to do very well. I would think of this very similar to when you give your children the other vaccines. So I don't in general think you probably need to plan to take the day off. But if your child is having a real sore arm and maybe a little bit of a fever, you may have to. So depending on kind of your work and your contingency plan, it is a good idea to think through that. Well, what would happen if my 6-year-old wakes up and has a fever? Well, we certainly know that's not a good idea to send that child to school. So maybe having a backup plan just in case. But those are the side effects that we're seeing in children.
That's so good to know. Dr. Higgins, can you get your kids a COVID-19 vaccine and a flu shot in the same day, in the same week? Do you need to space them out? Are there any pros or cons to making a decision about those two vaccines together?
Yeah, I love that question. So you can absolutely have them get their COVID-19 vaccine and their flu shot at the same time. And in fact, you can have them make sure that they're up to date on their other routine vaccines that we recommend in all kids. And I'm going to take this moment just to plug both of those things, the flu shot and routine vaccines. Okay, unfortunately, we have seen that through the pandemic, for a multitude of reasons, other routine vaccines, some kids are behind on them, right? Opening them up to other infectious diseases. And so it's really important that your kids are up to date on their routine vaccines and the influenza, the flu vaccine. So you can do those at the same time.
That is really good to know, especially for busy parents. Just stab my children with everything, please. This next question I also had on my list to ask for personal reasons. Dr. J, my kids both have shot anxiety, and they're at a really tough age. I think a lot of 5 to 11-year-olds are in this tough age where they're not babies and you can't just kind of jab them, but they're not quite old enough to control a lot of their emotions. What do we do about kids with shot anxiety who we might have trouble getting to the site and then going through with the whole shot?
That's a great question. there are several things that you can do. And, you as a parent, you know your child best. So certainly, tuning in and thinking back, well, how did we get through, our kindergarten shots? But in general, one thing you want to do is really, really hear them. Don't minimize those symptoms. So it's important to listen and to say, I know this is going to be hard, but it's important. The words we say as parents really do matter. You may want to avoid the word shot. It might work better to say something like, we're going to get a poke. Also, for some children, it may help to kind of do a little bit of role playing and get out the teddy bear and say, this is what it's going to be like. I know this is hard for you. I'm here as your parent, to comfort you and help you get through this, and I'll be there for you. For some kids, it's helpful to give them something to look forward to afterwards. Gives them something to focus on. After we go to the doctor's office, we're going to go to the park. We're going to go to your favorite place to get ice cream. Those little things help as well. And then there are a few things right during the visit that sometimes you can try, whether it's deep breathing, thinking about something, ahead of time. Hey, we're going to think about that vacation we took at the beach, something to kind of give children something else to focus on. So those are really, really good questions.
Thank you. That was so comprehensive and helpful. And I'm really impressed you didn't say bribe once during that whole answer. I'm going to give this next question to both of you. And I've never read this word out loud before, so excuse me if I don't say it right, but I've been reading it a lot recently. Myocarditis, is that the word?
That's the word.
That's the word.
Very good.
So
very good.
Okay, thank you. So that's coming up a lot, along with any conversation we're having about kid vaccines. Can you talk us through what it is and whether we should be worried, what we should know, and maybe how prevalent it is?
Yeah. Oh, this is such a good question. So myocarditis is a very rare adverse event from being vaccinated, very rare, that we actually picked up with our really robust safety systems, okay? And what myocarditis is it's inflammation of the heart. It occurs after a COVID-19 vaccine. It occurs most frequently in older adolescents and young adult men. But I want to make something really clear. We all have a hard time with big numbers and risk, right? That's just all of us, our mind kind of goes blank when we hear these, 1 in millions, So this occurs very, very rarely, all right? In the older adolescents and young adult men, we're talking somewhere in the order of 10 per 100,000 doses of the vaccine, okay? And in the clinical trial that was done in 5 to 11-year-olds, there were no cases of myocarditis. Although we did not do 100,000 kids, right? Because that is not practical to do in a vaccine trial. What we do know is that these cases of vaccine-induced myocarditis, almost all the cases are mild, and generally people get better very quickly. And I think the expectation that we have is that it would occur even less, even though it's already super rare, that it would occur even less frequently in 5 to 11-year-olds because we're using a lower dose. And because we have seen that the younger kids are less likely to get this than the young adults. And I think this is so important when you're thinking about this. This is how I've been thinking about this as a parent, right? So you're not weighing the risk of a very extremely rare side effect from the vaccine to nothing. You're weighing the risk of this extremely rare side effect to the risk of hospitalization, myocarditis, or death from COVID-19. And the risk is much higher that your child would get COVID-19 infection and then develop myocarditis or hospitalization or MISC, which is a disease that often involves inflammation of the heart as well. So that risk is much higher. And that is why, when we've looked at the risk benefit, that's why we have recommended this vaccine, even though we have seen this extremely rare side effect.
So it's also something you can get from COVID-19. That's interesting. Mhm.
Yeah. I'm glad you brought that up.
Oh.
Not only can get from the COVID-19 infection, but the myocarditis that is seen with an actual COVID-19 infection tends to be a more serious illness where the hospitalizations are longer. More of these children are requiring intensive care or medications, where the myocarditis associated with the vaccine seems to be a more mild condition. Where you come in and in a couple of days, most of those young men are going home. So even the myocarditis itself seems more severe following an infection than the myocarditis that we see, again, very rarely with the vaccine. So it's real. There is an association, but very, very rare.
That's really good to know. And I didn't know a lot of that. So that's excellent. We just have a couple more questions. And if you do have more questions, feel free to get a quick one in. We've gotten several questions from people who say, my child has this blank medical problem generally, like they have a history of seizures, or they're immunocompromised, or they have some other history of illness or disease or some condition that makes them worried about getting the vaccine. What should you do if you're wondering if the vaccine's right for your specific child? Why don't we give this one?
Ask your pediatrician. That's what we do. We have most of us, wonderful phone nurses available. We're happy to answer those questions. But in general, COVID vaccine is for most kids. There are very rare reasons not to get the COVID vaccine, which would have to do with an allergy, a severe allergy to the vaccine or a component in the vaccine. So reach out. That's what we're here for.
Mm-hmm.
I think that's such good general advice, especially as this session comes to an end, is to ask your pediatrician or call your medical office if you have specific questions and really want specific care for your kid. We have two more quick questions. This one's from Anna. Prior to the Delta variant surge, adults who were fully immunized were welcome to go mask-free in many indoor locations. Do you anticipate that to be the case for fully vaccinated children?
That's a great
and I'm
question.
sure this is a question that has to do with masking in schools as well, right?
Yeah, that's a great question. So vaccination is one piece of multiple, we call them mitigation measures, but really multiple layers that protect our children and our community, okay? And masks are another piece of that. And so, I don't think I can give a good answer on that right now, because it'll have to do with a lot of things like, how many kids are vaccinated, and how, what's the amount of COVID-19 disease in your unique community, and some things like that. Okay, so we can't give you a firm answer on that for those reasons, that it's a part of multiple layers.
Great, thanks. And our last question is, I have a kid who's 4 3/4. Can I get them the shot?
I have a kid who's 4 3/4 also. And sadly, no. Sadly, not yet. Okay, so clinical trials are ongoing. Okay, and we think that the next group that is we're going to have clinical trial data on is going to be 2-year-olds and up. Okay, 2 to 4, and that we've heard early 2022, right? So maybe fingers crossed. Sometimes we'll know more in December or January. But unfortunately, right now, not yet.
But you can cocoon everyone around your 4 3/4-year-old. So we talk about this a lot when parents bring home a newborn, right? That newborn can't have any vaccines. So we talk to the parents and the siblings about getting their flu shot or their whooping cough shot. So you can feel better knowing, if an older sibling or a cousin or someone else who's 5 or 6 is playing with your 4 3/4-year-old, you can take some comfort in that.
That's such a great point. As we talked about before going live here, siblings don't share anything except germs, right? When one kid gets it, it just goes through the house. And so you can create that bubble of protection by having everybody else vaccinated in the house.
Right. And I think that goes back to one of our earlier points, like, why should I get my super healthy kid vaccinated? It's not just about your kid. It's about not only other family members, but your whole community.
Mm-hmm.
It's about those kids who are still under 5 as well. All right. Is there anything else that you two want to share before we close down our session?
I think that my final thoughts, the vaccine is safe and effective at protecting against serious harm due to COVID-19, right? Even in healthy kids. And that's why, as pediatricians, that's why the American Academy of Pediatrics recommends this. And that's why I'm not hesitating to vaccinate my own 7-year-old daughter. She's going next week, and I'm really excited. But if you have any concerns or questions, lingering thoughts, talk to your pediatrician, talk to that trusted source, okay? And as pediatricians, we have dedicated our lives to the health of children, and we're there for you to listen to your concerns, to help you walk through those and help you make the best decision for your family and your child.
Thanks.
I think you said that so well. I mean, this is an exciting opportunity. Reach out to your pediatrician. Look for, Montana AAP or healthychildren.org. We're happy to help navigate this, because this is new. It's complicated. So don't hesitate if you have questions. Talk to your physician or your family medicine doctor, your pediatrician, and we'll help you.
Thank you so much. And I just want to say thank you not only for the session, but you two are on the front lines, I know, and thank you for all the work that you've done over the last 20 months or so. We really appreciate you, and we're so glad you could do this for us today.
Thank you. It was
Thank
fun.
you, Sarah. Yeah,
All right.
I really enjoyed it. Thank you.